Okay, I am going to be performing, setting up a sterile fill today. I'm going to go ahead and check my doctor's orders. I'm going to make sure that if I need to do any type of PPE and what solution is ordered. So I have all that here. I'm going to go to the supply and gather closet to gather up all my supplies. I may have got my sterile filled and my bowl. It all is sterile, intact, within expiration. I'm also going to get my gloves and my 4x4s. They are sterile within expiration, and my fluid is 0% normal saline, brand new bottle within expiration. I'm going to gather up my supplies, go to my patient's room. Knock, knock. Hi, my name's Amanda. I'm going to be the nurse taking care of you today. How are you doing? Great. I've got a clean, dry surface to set my supplies on in my sterile procedure. I'm going to go ahead and wash my hands. Can you go ahead and give me your name and date of birth? Jesse Wilson, 6'9", 1942. Great. Give me just 1 second. Let me verify that. Okay, that's what I have. And I do have the correct patient, and I do have the orders on there. I'm going to be performing a setting up a sterile fill for you today. It is sterile, so if you need to talk, cough, sneeze, if you could just turn your head to the left, that way my sterile field stays sterile and the doctor will come in and perform the procedure. Do you have any questions? Great. All right, we're going to go ahead and get started. I'm going to go ahead and start opening up my, let me get everything in order. Okay, so I've got my field. I'm going to reach in without crossing. Reach in without crossing. Okay. Next, I'm going to go ahead and open up my bowl. I'm going to go in, away. I'm going to go ahead and form a mitt. Reach in without crossing the bowl. Okay, I'm going to set that down. And I'm going to throw that in the trash. And I'm going to get my 4x4s. Open out the way without crossing. Okay, I'm going to come over. So those are a little bit questionable, so I'm going to go ahead. I brought some extra ones, so I'm going to go ahead and open my extra ones just to make sure. Okay, those are better. So those we won't use, they're on the other side. I'm going to go ahead and get my solution. I've double checked. I know I've got the correct solution, 0.9% normal saline. It is within expiration. So even though it's brand new, I'm going to go ahead and lip it. Open this up, keeping my eyes on my sterile field at all times. Okay, I'm going to lip it. Now I'm going to go in from the shortest distance without splashing. Okay, put the lid on it. I'm going to go ahead and date, time, and initial. Okay. Now I'm going to set this off to the side. I'm going to go ahead and get ready to put on my gloves, but before I do that, I'm going to go ahead and do another medical hand wash. All right, I am going to open my gloves. without crossing into my 1-inch border. Okay, I'm going to go ahead and grab my dominant hand. Okay, then I'm going to reach in here. I can go ahead and hold the paper down. I'm going to get as much of my glove as I can. I'll make adjustments on the other side. I'm going to hijack my thumb. Okay, and then I can adjust my fingers here because I'm sterile to sterile. Okay, so now I'm good. I'm going to reach in, making sure only the sterile portion of my glove can reach in through into the sterile field. I'm going to go ahead and grab my 4x4 and I'm going to put it into my bowl. At this point, my sterile field is over. Are you doing okay, Miss Wilson? Great. I'm going to go ahead and clean up from here. I'm going to grab my stuff. I'm going to collect up from the inside, not to touch the table. I'm going to put all this into my trash can. Clean up all my mess. I'm going to do glove to glove, skin to skin. I'm going to go ahead and do a medical hand wash. Before I leave, I'm going to document. I'm going to come over here. I'm going to document if I broke sterility. I'm going to identify any expected or unexpected outcomes. Everything was expected. We maintained sterility. I would notify the healthcare provider if there was any type of abnormal findings. But then I'm going to document that I maintain sterility at all times during the procedure. Then at this point, I'm going to be ready to go. I'm going to go ahead and do my safety check. I'm going to make sure my bed's in the lowest position. Side rails up ×2, bed is locked, call light in place. Please let me know if you need anything. Here is your call light. I'll come back and check on you within 30 minutes. I'm going to go ahead and do one more safety check. Bed in lowest position, side rails up ×2, bed locked, call light in place. Please let me know if you need anything, and I'll come back and check on you. Thank you very much. I would leave any supplies in the room as we don't want to take them out. I'm going to do a medical hand wash before I leave. Thank you.